everyone. Welcome back to the Grow RDH Podcast. My name is Katie and I'm your host for today. Today we are going to sort of get back to our regularly scheduled programming. And if you have been listening for a while, you know that I interviewed some really great, amazing hygienists for the month of October. It was National Dental Hygiene Month. And I still have some upcoming interviews that are scheduled and that should be coming out. And maybe I'll make it a monthly thing. Maybe like the first week of the month will be an interview. I'm not sure. I have some coming up, some scheduled, and so that's exciting. But I do want to get back to sort of some really good topics that I had in mind coming up to the end of the year. And one of those topics is going to be conflict. I don't know about you, but I don't like conflict. I don't think anybody does. And I do also think that it's important that we address conflict and kind of take it head on. So I'm going to explain some of the things that we are going to be talking about in the next few weeks. But first, because I have developed this planner, I'm going to be talking about the planner. This episode today is brought to you by the Dental Hygiene Planner. And if you have been following me on socials, you know that I launched the planner November 1st. So I do have some of the months in here tied to the planner. And the first month is going to be August. For the month of August, we have communication strategies. And I'm going to be referencing these as I go through conflict. And I think it's important. The September month is interest-based approach to conflict. This is a approach that is evidence-based. This comes from Getting to Yes. This is by Fisher, Urey, and Patton. And the interest-based approach by Brad Sprangler is something that we have used in my career. I've used it in my institution. I've also taught on this. I help with the summer leadership course, and the interest-based approach to leadership or to conflict is something that we really push in our leadership program. And so I'm going to be referencing or referring back to a lot of these things. And I just think it's a really great approach to understanding why conflict happens, how to approach it effectively. And so if you're interested in learning more details or you want to get the hands on the planner, please purchase today. It's in the link in the description box. And I only printed a limited run just because I wasn't sure how it was going to sell and I didn't, want a bunch of inventory, but I do think they are going fast. I've had a really good response to these. And so if you are interested, the link is in the description. The Dental Hygiene Planner, if you are curious, it has monthly pages. And so each month there's a different thing. You can see the different video I'll link describing the planner. And so I'm going to quit talking about it. Dental Hygiene Planner. Go get yours. But so we're going to kind of take this in phases. The phases that we're going to talk about is understanding the conflict, approaching the conflict, which includes techniques, and then following up after conflict. I think the follow-up is really important. And so I think a lot of the times that kind of gets swept under the rug. So understanding the conflict, approaching the conflict, and following up after the conflict. So let's talk about it. First, let's talk about understanding the conflict. Understanding the conflict is essential to approach it correctly. A lot of the times, we have to understand the emotional needs of the person that we are in conflict with. And who are the people that we're most in conflict with as hygienists, right? The first group is our patients, and the second group is our coworkers. Those are the people that we are going to be in conflict with routinely. You can't get away from it. Routinely, we will be in conflict with patients and coworkers, and there's just no way around it. So we have to understand where the source of the conflict is coming from. Most often, conflicts come from unmet expectations. And there is research behind this. unmet expectations are the number one source of conflict. And it's important for us to understand what those unmet expectations are. For patients, it might be treatment. It might be you just told them they need SRP when they were coming in for a prophy. For coworkers, it might be work duties. It might be delegations. It might be different priorities, right? I know one source of conflict in one of my work areas is one of the assistants really prioritizes something. I'm not going to give personal examples here. And the other assistant just doesn't view that as a priority. And they have some conflict. And so a lot of the time, it's unmet expectations that kind of result from missed opportunities to communicate those expectations. And a lot of the times when we're talking with others about unmet expectations, a lot of the times they're like, but I didn't know that. Or how was I supposed to know that? I can't read your mind. And so a lot of the times we'll hear that come up in conflict resolution. And it's true. It's if you are feeling frustrated about something, it's so important to communicate that. You have to communicate. And even if you're a shy person, an introverted person, a person that does not like conflict, there's many of us that don't. Even if that's you, the only way to get to the result you want is to communicate that. You have to communicate it. And so we have to practice that. We have to practice that. And again, I'm going to reference the planner. There's a few things here that we need to do to communicate appropriately. And I'm not going to go super into detail here, but one is body language. We have to make sure that we're matching energies. We have to practice saying no when things don't align with what we want. And when they don't align, we have to verbalize why they don't align. Again, having unmet expectations a lot of the times is just a lack of communication. So if you don't want to do something, you have to say that you don't want to do something, right? And that prevents a lot of conflicts from even happening in the first place. A couple nice ways to say it. I'll read directly from the planner. I have other commitments that require my attention, or my current job duties take priority at this time. I don't have room in my current job duties. Something like that. Another technique, and maybe this I'm getting ahead of myself, when we're approaching conflict is to stay calm. But even understanding, when we're understanding the conflict, we have to stay calm, because staying calm allows our rational brain to work. And sometimes if we go into fight or flight or freeze or fawn, if we go into that state, becoming more self-aware that we're in that state is going to allow us to come out of that state faster. And we don't want to make decisions. You're not going to be able to understand someone's emotions or reasons for a conflict while you're still in your fight or flight state. And so learning how to process your fight or flight response is going to be essential to get you out of it, which that is a whole other topic. We can do a whole other episode on that later. But let's just first understand that we have to analyze the situation. And in order to do that, we need to be in our right brains. So we're acknowledging our emotions. What emotions are you feeling? What is triggering the person that you're having a conflict with? And what is triggering you? What is happening emotionally? What is the source of that emotion? Is it unmet expectations? Is it miscommunication? Is it something completely different? So once we've analyzed that and we understand where the conflict is coming from, we want to choose how to approach the conflict. How are we going to approach it? And there's multiple different ways. Just like a patient can refuse treatment, we can refuse to confront, right? So avoidance is one approach to conflict. You can avoid it completely if it's a hill that you do not want to die on, right? Sometimes people refer to this as pick your battles. If this is a battle that you do not want to pick. You don't want to address it because you think it's unnecessarily going to escalate something, or maybe you're not really understanding the conflict fully and you just want to wait or sit on it or see what happens. That's completely warranted. But a lot of the times, if you avoid it for too long, it comes back with a vengeance. And then you start to have feelings of resentment, which in a work situation is not where you want to be. You do not want to feel resentment. You do not want to feel, I guess there's no other better word for it. Resentment is the best word for this. And so what you want to do then is you've avoided it and now it's coming back, right? So now we decided, okay, we're going to approach it. We're going to approach this head on. And the interest-based approach to conflict management is a collaborative method. And that's going to be part 2 of this episode series. This is part 1. We're going to go into part 2 more in depth. So wait for next Friday to get that. But the interest-based approach to conflict management is a very in-depth, step-by-step method to collaboratively get to a problem. And it's a problem solving technique that's specifically used like in a co-working setting. This isn't necessarily useful for patient management, but for co-working situations or employment situations, the interest-based approach to conflict is amazing. It's amazing. And so we're going to talk about more in depth there because I just want to focus on the whole problem. This is kind of a 100-foot level view. And then next week, we're going to break it down to like a 10-foot view. So different approaches could be collaborative, which is the interest-based approach. It could be compromising. It's a give and take, right? You are making compromises for a patient because you want them to still have a relationship with you. So anytime we're in a relationship type of setting, right, based on with a patient, we want to build that relationship. We sometimes do have to compromise in order for us to maintain the relationship. And with a patient, that's essential. Accommodating can also come into play here. We can accommodate a patient even if it doesn't align. And this goes back to motivational interviewing, right? The patient is the expert in their own life. If we obviously have conflicting views about a health practice, maybe it's smoking, maybe it's the use of an electric toothbrush, and these are just minor examples, but hear me out. We can accommodate them, right? We know they're smokers. They don't want to quit smoking. We're accommodating them because maintaining the relationship is more important to us than dismissing them and not being able to maintain a provider relationship with them when they've done really good on other things. So accommodating is another approach that can lead us to deeper relationships with patients. And this is true for coworkers as well. Accommodating a coworker that you know may be in a bad situation, or you know that it is not something that you want to address, you're accommodating a behavior or a practice in a coworker that you just don't, you're going to choose that you're just not going to care about, right? It might be annoying to you. It might be something that just grinds your gears, but you're going to accommodate them because it is important to them. So accommodating and compromising are pretty similar. Again, it's a short-term loss for a long-term gain. And then there's being assertive. And I am an assertive person. I have been told I am intimidating. I have been told I am bossy or stubborn. Stubborn is the common one. But being assertive is essential to me to communicate clearly. To me, I get frustrated when people are not clear, or when people beat around the bush, maybe is a good way to say it. And being assertive is not a bad thing. If you've ever been told you're assertive, props to you. Pat on the back. being assertive is not a bad thing. Being assertive means that you are clear in what you want, you're clear in your expectations, and you have boundaries by which you manage your practice, your life, and everything in between. Assertiveness is a great tool for conflict management, and sometimes that comes off as being stubborn just because you have clear boundaries. Being assertive people, it doesn't mean that they won't compromise. It doesn't mean that they won't accommodate. It means that they feel strongly in their beliefs and in their actions, and compromising requires explanation and expectation. And I'm an assertive person, and I will be the first to admit it. Unfortunately, that does impact my career sometimes. It impacts my teaching with students sometimes. And I've come to be at an age where sometimes I just don't care. I'm okay with being unliked for some of my decisions and some of my beliefs, and that's okay with me. And if you feel that way too, again, I just don't let people talk down to you because you're assertive. All right, we're going to keep going. So if we are ready and we understand the situation, we understand the conflict, and we understand how we want to approach it, are we going to accommodate? Are we going to compromise? Or are we going to be assertive? Or are we going to just completely avoid? And so those are kind of the 4 approaches that we have. And we're going to approach this with our communication tactics, right? So let's go back to that. I'm going to go to August. Staying calm. So this is true for the whole procedure. I'm such a dental hygienist. This is true for the whole conflict, right? The whole interaction. But when you're implementing the techniques that you want to use, so I've decided I'm going to be assertive in this situation. It is essential for me to stay calm. When I feel my emotions rising, everything else rises with it. My voice rises, my body rises, my eyebrows rise. And if I can stay calm and regulate my reactions, regulate my body language, regulate my voice control, that really helps to keep a level playing field, right? Even if I'm assertive in my approach, I don't want to come off as intimidating because I don't want people to feel intimidated. So assertive doesn't mean intimidation. Assertive just means strong in belief. And you can do that with practice by controlling your nonverbals, by controlling your emotions and staying calm and maintaining that demeanor throughout the whole entire interaction. And that's what we're really looking for. So staying calm, it's one of the recommendations with a couple of different advice techniques. Another thing to do is speak clearly. I struggled with this one. I struggled with this so much. And you can see it if you've ever had an email exchange with me. Speaking clearly is really difficult. I speak clearly sometimes, but what we don't want to do is editorialize. A lot of the times when we're just feeling passionately about something, we want to get our point across, and we're going to come up with 20 different ways to explain it, or 20, I'm going to give examples and I'm going to go into detail. A lot of the times it's like the TLDR, right? If people write on a social media post TLDR, too long, didn't read. And that's what's going to happen. People need bite-sized, clear clips or written correspondence that they are not going to zone out, right? If something is super long and I'm editorializing and I'm explaining, and pretty soon you're going to see their eyes glaze over. And this is true in school too. When I am students, this is why I don't lecture over 20 minutes, because people don't want to be lectured to. And that's a proven fact that research supports anything over a 20-minute lecture in class doesn't do anything. They check out. They're gone after 20 minutes. And so we don't want to lose our audience. And so if we can concisely keep our argument down to something that they understand clearly, that is going to be huge in getting our point across. And I struggle with this. If you can cut it down, cut out the fluff, cut out the extra, just be clear. Get it down to a sentence or two. What do you want? And that will really help with the people that we're working with and the people that we are trying to negotiate with. And it's just really important. Finally, we're going to talk about following up after the conflict. This is really important, especially if you're trying to maintain relationships, which with our patients and our coworkers, both, we are trying to do. Following up for patients means that we write about the conflict or we write about the disagreement in the note. Again, ethically and legally, this is a legal document. So we want to clearly document what happened, what the conversation was. If you can have a third party also document what happened, that would be great because that can be subpoenaed for a court case. So documenting is good, but it also helps us follow up. So not on the legal side, it also helps us follow up. And it's important for us to ask them, maybe call them after a week and say, hey, after we had our discussion, I was just wondering if you had any questions, how you felt about it, or how you want to proceed. And for coworkers, sometimes we have to follow up, right? Because we have to work with them every single day. And that's important too, to maintain that working relationship. You don't have to like somebody to work with them. You don't have to be friends to work with them. You do have to respect them, and you do have to treat them with respect. And following up after conflict is respectful. And it levels the playing field. So no matter what the outcome was, it levels the playing field for everybody to be on the same page. And I know that's really hard because not all conflicts end the way we want them to. If a conflict doesn't end the way you want them to, you still want to follow up because you're probably going to have conflict again in the future. And if you don't follow up, it's just going to be sort of like this festering thorn in your side, and it's going to cause a lot of resentment. So follow up after conflict. Make sure that expectations were laid. You now have better, more clear expectations about how that's going to happen in the future. And you're both on the same playing field. That's really key. If people feel empowered to make their own decisions and they feel like they're on the same playing field and they understand the rules of the game, that is essential. So following up means you're talking about what happened, you're talking about the outcome, and you're making sure that you both understand now going forward how that conflict will be managed in the future. So hopefully that was a fun, helpful talk about conflict. Conflict happens all the time, and it's okay. It's okay. Sometimes we're more comfortable dealing with conflict than others, and just learning or practicing will make you more confident in the future. Next week, we're going to talk specifically about employment conflict and how the interest-based approach to conflict can help you get the results you want. So it's a little more in detail about if you were having to negotiate an issue, how would we do that step by step? So that's coming next Friday. Look for it. Make sure to like, subscribe, and share this podcast with anybody that you think could use it. And go ahead and get my planner if you're interested. Again, limited run on these. So there is limited inventory. So if you're interested in one, please grab a hold of yours today. And with that, I will see you next Friday. Bye.